Thank you. My name is David Graham. I'm a professor of ecosystems engineering in the School of Engineering, and I'm going to tell you about work we've been doing really over the last 20 years. And I've called the talk Fighting the Next Pandemic. And I think it's very topical right now because of the fact that we're in the middle of another pandemic. And hopefully through the next 20 minutes or so, I will be able to explain to you what the next pandemic actually might be and how it might affect us and how we're trying to address the problem now before it actually becomes too bad. The talk is really going to be divided into three parts. One is basically one large background, trying to place this into some sort of practical context. And I'm going to strongly emphasize the interconnectedness of nature, which really is part of the problem. But also the interconnectedness of solutions, which is, I think, one of the things that we're trying to promote around the world. I'm then going to talk about resistance, and I'm only going to give you a couple of examples of where things are more complicated than they seem, and solutions are not so black and white. And finally, I'm going to talk about some of the solutions we're working on, basically trying to reduce the next pandemic. And in a nutshell, the next pandemic is increasing antibiotic resistance around the world in medicine and veterinary medicine. So I'm going to start off by the standard definitions so as people understand what I actually mean. So antibiotic resistance is the next pandemic. It's actually, I personally believe it's a pandemic now, but we don't know it because it's silent. So what resistance basically is in simplistic terms is the capacity of a microorganism to defend itself against antibiotics and antimicrobial agents. Now, the thing that people often don't understand is that resistance is not something that's just happened. Resistance has existed for millennial time. And in fact, there's copious amounts of background resistance in nature, which we call intrinsic resistance. And this is just bacteria, microorganisms, produce little chemicals that defend themselves. Originally, the antibiotics we used in medicine were actually derived from microorganisms. When we talk about the resistance pandemic, it's actually the resistance pandemic of acquired resistance. And this is resistance that has evolved very rapidly in recent years due to the fact that we use antibiotics too much and in the wrong places. And it's rapidly increasing. And one of the things that we know is that what we're functionally doing by the nature of how we use chemicals is we've increased the background level of intrinsic resistance. So we've functionally accelerated evolution. Now, in a very broad sense, the primary driver of resistance is antibiotics that are being used and resistance that might develop within the gut. We also know, however, that it does evolve in the environment, and in fact, the new evolution of resistance is often in places where there's fecal material from the gut mixing with very polluted environment, particularly surface water. But resistance spread is actually primarily through the environment. And in this case, I'm primarily talking about waterborne resistance spread. Therefore, water pollution plays a really big problem in the rates of spread. Now, to give you a sense of how significant this is in a global sense, I'll just use one example from some excellent work by Peter Hockey at the University of Birmingham. And he basically did an assessment, this was in about 2009, of this one particular type of resistance. It's called extended spectrum beta-lactamase, ESBL. And it was novel because it was quite a serious type of resistance, and it also is a serious type of resistance in medicine now. But in 1989, it was really only detected in one place, and that was in Eastern Europe. And what happened, though, over the next few years, the resistance moved from being in Eastern Europe to be global. And without going into the details of the colors, those are variants of the original form of the resistance. So it got spread very quickly, but it also evolved and changed very quickly as well. And so this is actually, when you think about what's happening in the current pandemic with SARS-CoV-2, this is actually what's happened in the current pandemic. So this is actually happening, what I've just shown you to do with resistance. But if you think about it by analogy, this is an equivalent map that we generated last week, looking at the spread of COVID-19 cases, and this is over 7 months. So we initiated, it started in China, it moved to other parts of the world, and it progressively increased. And now, after only 7 months, it's become functionally global. Now, I, for all intents and purposes, believe the same sort of thing probably happened relative to antibiotic resistance. And so the fact that we saw it move so fast wasn't so surprising. But the difference with antibiotic resistance is it's actually not resistance to one particular infectious agent. It's the use of drugs. And in fact, antibiotic resistance of the type I study is usually waterborne rather than airborne. So it's a different type of transmission pathway to SARS. But it basically shows you the same patterns have existed with antibiotic resistance, which we are calling the next pandemic. But in reality, I think it's also happening now. It's not very much different than COVID-19. Now, to understand resistance and understand why it's so tricky and why it's sort of silent, and it's also hard to mitigate, is you have to understand what causes it. Basically, resistance evolution is something that happens at the cellular level within bacteria and other microorganisms. And it's a genetic and ecological phenomenon. You put it into simple terms. If you're ill, you've got a pathogenic bacteria in your gut or in your system, you take an antibiotic. That antibiotic stresses the bacteria. But what happens is bacteria are naturally developed, they're naturally evolved to start accelerating their own evolution when they're presented with something that stresses them. And it's sort of like genetic roulette. All the bacteria that are stressed are spinning their genes all over the place, and in fact, 1 or 2 bacteria will win. In fact, they'll have rearranged their genes to a point where then they become competitive and they become dominant through ecology. Now, the problem is this is happening everywhere that you use an antibiotic or use an antimicrobial agent. It happens in medicine, it happens in veterinary medicine, and it happens in polluted water in South Asia. Now, and this is happening everywhere all the time, so we can't really actually say as explicitly where it came from. And because of all the different types of resistance, it's not as easy as doing genetic source tracking as we've done with SARS-CoV-2. And the problem is, and the reason why this pandemic has been happening silently is the point of contact that you know that resistance has spread is when a treatment fails. So initially people made the presumption that the point of resistance evolution was the point of use. So when a physician or a vet found a resistant infection, they assumed it was related to that source. But in reality, almost certainly 60, 70, 80% of the resistance that you see in a clinical environment was acquired somewhere else, more than likely in the natural environment. So let's think about this from a practical perspective. We're very lucky. We live in a place where we've got wastewater treatment and we've got water treatment. So when we take an antibiotic, it goes into our gut. We have this genetic roulette happen in our gut, and then we defecate. But we defecate down a sewer, it goes into a wastewater treatment plant, which reduces the levels of resistance. It goes into a river or stream that's relatively clean, but then we treat the water. We treat it before we use it in agriculture, and we treat the water before we use it as people. So we've got a safe food system, we've got a safe water system. And therefore, we've come to believe, as Westerners, that the main problem we have relative to antibiotic resistance is use. But let's think about the rest of the world. Only 73% of the world has got sewers. 27% of the world does, 73 doesn't. So therefore, if you defecate in a place where there isn't a sewer, and you don't have some sort of safe sanitation, your fecal matter goes directly into the water. It goes into the soil, but most importantly in the water relative to exposure. Now, you end up with dirty rivers, polluted rivers. Now, there's a little more water treatment, but the bottom line is you're creating a less safe environment relative to the potential spread of resistance and other infectious disease. So it contaminates the food supply. So rather than just having the problem based on using antibiotics, When you use an antibiotic, because you don't have a safe sanitation system and a reliable water supply, you're creating a recirculating network of resistance that goes around and around and around. And you accumulate resistance in the guts of individuals, and they may not even be individuals that are using antibiotics because they're being polluted from the environment rather than from taking the drug. So it's driven by the use of antibiotics, but it's not. The circulation and migration of resistance is something that's more environmental. So just to give you an idea of the relationship between civil infrastructure, and this is what I mean, it's sort of water, wastewater treatment, and also the services that we in the UK take for granted. This is a picture of civil infrastructure, and part of that's related to safe sanitation around the world. This is from a paper from a colleague of mine, Peter Collignon from the National University of Australia. And basically what they did was they looked at the levels of safe infrastructure in different parts of the world. And it's kind of obvious. Places like Western Europe, North America, Australia, parts of Southern South America, the level of sanitation is very safe. It's sort of like I described in my simple box and line model. But if you look at the level of if you look at the levels of resistance that's in those communities, sometimes they're not the same. So I said, first I just told you that sanitation and infrastructure was important. But in reality, the level of resistance you get is not just based on that. It's based on how you use antibiotics, where you use them, how much is used in agriculture versus medicine, other forms of pollution, whatever. And then there's sociological and economic reasons why you might find higher levels of resistance. So if you say compare different parts of the world where you had what appeared to be a relatively reliable civil infrastructure, it doesn't directly correlate to resistance, and it's because of local complications. So what I want to do is relatively quickly talk about a couple of complications, just to give you a sense of how fighting this pandemic is a bit trickier than maybe people would think. And it's a very complicated. So I've just decided to choose 4 examples of things that we have to think about that make it more complicated. The first one is something I call sanitation and herd transmission. Now we listen to the news and we hear about herd immunity. And herd immunity is something that happens if you start accumulating as a population immunity amongst individuals. Therefore, functionally everybody's safety starts protecting everybody else's safety. Well, unfortunately, in antibiotic resistance with, say, bacteria, it's the opposite happens relative to the herd effect. In this case, this was a study we did on U.S. cattle feedlots about 15 years ago. And what we did was we looked at 27 waste systems from feedlots, and we looked at systems that didn't use antibiotics, used them only therapeutically, and then during quarantine, so they removed the animal, they treated them and put them back in the herd, and then they also used them for therapeutic and non-therapeutic reasons, such as growth promotion, which is done much less now, but still it's done in many parts of the world. But the critical thing is that if you look at the effect of resistance in the lagoons, which is a metric of the fecal matter that's coming out of the cattle, that the level of resistance you find is about the same if you've only used it for therapeutic reasons versus non-therapeutic reasons. And first, we had no explanation for that. But when we started working in India and working with IIT Delhi and colleagues there, we started studying the migration of individuals around polluted and unpolluted areas of the country. And what we discovered was that if you used antibiotics in an individual, even if you quarantined them and that individual went back and then joined the rest of the community, they defecated. And if you didn't have safe sanitation, they polluted the water of all the other individuals. And therefore, everybody within the community, even individuals that didn't get the antibiotic, were getting resistance. And it was because of water pollution. So that's the reason. The key is if you add resistance, if you add an antibiotic, you take it, you don't fully quarantine, and you don't have sanitation for the individuals, everybody gets resistance in their gut. And in fact, we've shown that in a number of studies more recently to do with human populations, primarily in Southern Asia. Another example of a complication is one that I chose this is not our work, but it's work we discovered when we were doing a resistance to do with animal agriculture. And it was the effect of domestic pets on vancomycin resistance, this particular type of resistance of significance in medicine. What it was observed was avoparcin use as a growth promoter, this was in the late 1980s and the 1990s, was associated with VRE resistance in animals. And they also found it associated with humans, so they banned avoparcin use in agriculture. And levels of VRE reduced in animals, but it didn't reduce in humans. And what was discovered based on genetic analysis done 10 or 15 years later was dogs are a reservoir of the genes that cause VRE. So even though we might have reduced avoparcin resistance, our pets were acting as reservoir for the resistance and reinfecting humans. Now people know about this, they're working on this, but it shows you things don't actually happen the way you think. It's not just agriculture polluting the rest of the community. It can also happen to do with our pets. It can happen to do with our friends. And once again, there's analogies relative to what's happening right now with SARS-CoV-2 and COVID. Another factor that's very important, and this is something that my group has done quite a lot of, is looking at international migration of resistance through unexpected pathways. And I'm not going to talk in any great detail. Probably I could talk for 2 hours about this topic by itself. But what we were basically doing was looking around the world for different types of multi-drug resistance. And I also happened to be doing work in the high Arctic on greenhouse gas fluxes. So we figured, well I wonder what we'd find if we did a genetic analysis like we would do in Bangladesh, but we did it in Svalbard. And what we found was functionally the same genes. But the interesting thing was they were only placed where migratory birds were. So what we discovered is that functionally that resistance in places where there maybe was poorer water quality, but there was wildlife, the wildlife became carriers. And they were carrying the resistance around the world. We haven't delineated this in any great detail. The groups in Denmark have done a pretty good job of this. But the bottom line is, we still don't know 100% it is the birds, because it could be migratory humans as well, which then feeds into the complexity of trying to understand the problem. The final example I want to give is one related to work that we didn't do, but we have colleagues that did this work. And it was looking at use. Now I said the original driver of resistance was how the antibiotics are used and the evolution of resistance in the gut. But I said it's exacerbated in terms of spread when you have poor water quality. And this example is a study that was done in rural India in informal healthcare facilities. We didn't do this study ourselves, but we know of the group that did it. And what they discovered was something quite astounding. And it's something we suspected, but we didn't know for sure. But what they discovered was really significant. And what they found was that over 90% of the antibiotics that were being prescribed and given to patients in these informal environments were what we would consider extended spectrum drugs. And these are the type that we pretty well reserve for people who are very, very unwell or in dire circumstances in, say, ICUs in a hospital. And yet they were being given to patients that had often very minimal disease problems. Particularly noteworthy is fluoroquinolones, which are often they're often used for urinary tract infections, for example. Now, we could sit around as people who sit in our clean environment in the UK and say, well, this is horrific. This is appalling. But in fact, if you look at it from the other perspective, this is good medicine, but it's having a very negative effect. It's good medicine because these care providers are trying to protect their patients. So if you don't have good diagnostics, which most places in the world don't, and you've got a patient that appears like they could have typhoid, or some other disease that would be of great significance, what's your best solution? You give them the best antibiotic you've got, which for them is a multi-spectrum antibiotic that we would normally use in emergency care. So the result of this is that in places where you've got highest levels of maybe pollution in terms of water, the wrong types of antibiotics are being used, but they're being used sort of for the right reason. And so we've got to come up, this is sort of argues in favor of better diagnostics in a general sense. But it's once again, it's the complexity element relative to understanding the problem. So what do we do to fight the next pandemic? I've spent the last 15 or a little bit more minutes describing all the things that make this a worrying problem. And And what we're working at is, I'm an engineer. And when I first started doing work to do with mitigating drug resistance, I was looking at technical solutions. And in reality, I can build any technology that will treat the water pollution and remove all the resistance. That's not a technical problem. However, if we did that in the 73% of the world that don't have sewers, we could never afford it. So what we've decided as engineers is that we have to be a lot smarter, and we've got to be a lot less technological. We've got to address the behavioral and social reasons behind resistance. We've got to come up with better ways of helping people use antibiotics more wisely. We've got to try and enforce existing rules. We've got to empower residents. And I like this figure because the pictures on the left are three, the top two pictures are things that we're doing in Delhi right now. One is in Delhi, one is in Malaysia. The top is a focus group. This is talking with residents of informal communities in a very poor part of Delhi, where we're trying to understand from the people what their problems are. By understanding what those people view as their problems, what they know and what they don't know, when we can come up with better solutions. The middle slide is a seminar we're teaching researchers from a number of technical and industrial institutions in southern Malaysia. We are quite well known for the fact that we use microbial genetics in terms of fast-tracking resistance and genetic migration. So what these two figures show is that this isn't just strictly a technical problem. It's also not a medical problem explicitly, though the medical people are the ones that see the consequences. You've got to educate people. You've got to help people understand the basis of the problem. The people are very smart. If you provide somebody enough information and enough education, they more often than not make the right decision. But as you can hopefully see, the solution to fighting this pandemic is not just medical. It needs physicians, it needs engineers, it needs vets, it needs social and physical scientists, and they all have to be working together. However, me being an engineer, we do solve problems from an engineering perspective. And one of the things that we've discovered, because most of the world doesn't have sewers, what we need is wastewater treatment plants that are sustainable on local levels that don't need a sewer. And so these are sort of super septic tanks. Now the picture on the right looks like a Dalek, but it's basically a small reactor that we built that uses 4 aquarium pumps and domestic sponges. The thing that's so special about this technology, which we piloted with NewMed in southern Malaysia, is that it reduces resistance at the same level as the most expensive treatment plant that exists in Newcastle. So we can come up with better solutions, but we have to be smart. And so this is an example of where I think the technology is better fitting the need. In this case, what you need is something that treats waste like our world does, but in a place where sewers may not be all that reliable. So, final few points. First is, I want to pitch a couple of things that we've been involved in related to global health. I was part of the group that was responsible for writing the most recent technical brief that links water, sanitation, and hygiene, which is a global goal at the UN, and reducing resistance. And if we actually just think more about water, think more about sanitation, and wash our hands, which I think everybody will have heard relative to COVID, the same thing applies to do with AMR and antibiotic resistance. And that's what this brief does. It's quite useful, and I encourage people, if they want to know about what the WHO is recommending for reducing AMR, this document provides that information. On a more colloquial level, myself and Peter Collignon, the colleague in Australia, wrote quite a long piece for the conversation, which we called Scientists Around the World are Already Fighting the Next Pandemic. And for all intents and purposes, this is a summary of the talk I've just given. But it provides you a lot more technical details and discussions. And if you're interested in this topic, this is something that I think we have written to try and make it more understandable for the general public. So, in conclusion, fighting the next pandemic. We need to learn from the present one. We see the consequences of not containing the pandemic or not understanding the pathways. In the current one, we can be forgiven to a certain extent because this is something we didn't even know could exist. Now, I think our imaginations in science fiction, we could, but the bottom line is what happened was unexpected. Resistance, The resistance pandemic, though, is more silent. However, it's been estimated that there's going to be at least 10 million extra deaths, and I think that's a gross underestimation, and over 100 trillion pounds of extra costs in the next 20 to 30 years if we don't address it, and we don't address it quickly. It's a medical and veterinary problem, but obviously from what I've said in this talk, that it's not just healthcare, it's engineering, and it's also social issues. And I personally believe Newcastle could be a leader in this, because we have all the capacity. We've got people like my group, there's people in FMS, and also very intelligent people in HAS that are getting to grips with what we're calling as a global health solution. So I'm very happy to have been able to talk to you about this work. I hope it's been a little bit informative. And I want to basically say one last thing, is that I've been doing this for quite a lot of time, but I could have had a slide here with 50 or 60 people. Many of these people have been very successful elsewhere, and this is only the tip of the iceberg. These are the group that have been working with me in the last few years. But the people who work on this are critical, and there's the next generation of people who are going to solve the problem. So I encourage you to inform yourself about the next pandemic and do whatever you can yourself to try and help us fight it. Thank you.